We need to talk about private health insurance premium increases and why they seem to be going up by so much. This year's premium increase of about 2.7% was the lowest in 20 years. But it's a shame that premiums needed to go up at all, given that Australians have had such a tough year in 2020. The main driver behind health fund premium increases at the moment is the excessive price we need to pay for medical devices here in Australia. This is not a price that the health funds can control. To our great frustration, this is a price that's determined by the federal government through something called the prostheses list. The prostheses list has about 11,000 different medical implants, widgets, and bits and pieces which the health funds are obliged by law to pay for. Now, that in itself is not a bad thing, but the problem is that as a result of a deal with the big medtech companies, Australians are paying 30% more across the board for medical devices than most comparable economies. This includes the UK, France, New Zealand, and South Africa. There is absolutely no medical reason why Australians need to be paying more for commonly used generic medical devices. Every day, approximately $5.5 million is spent on medical devices in Australia. And of that 5.5 million, $2 million is shipped directly offshore as profit to the big medtech companies, providing no additional value to Australian patients. The federal budget this year will be a big opportunity to start to redistribute some of the profits made by big medtech to Australian consumers, doctors, and hospitals. The only way health funds can control premium rises is if the Morrison government steps up and fixes this broken system so that Australian consumers and patients get value from their private health insurance.